In every jungle, there is a story of survival, of strength, and of silent battles. But today, we enter a different jungle, one not filled with lions or safari, but with courage, awareness, and hope. This is the jungle of survival. Every creature fight for survival, but there is one silent battle. Many women face a battle not against predator, but against breast cancer. For centuries, breast cancer has been one of the greatest health challenges faced by women. The earlier description dates back to the ancient Egypt around 1600 BC, where physicians recorded cases of breast tumor, but sadly, at that time, no cure exists. It was not until the 20th century that medical science began to understand the nature of the disease and discover that earlier detection could save lives. In Nigeria, 1,000 battle breast cancer each year, around 27,000 new cases are reported annually. From 2005 till now, the number continued to rise, yet awareness and screening have saved countless lives. Knowledge remains our grand weapon. So what is breast cancer? It is a condition where cells in the breast begin to grow abnormally, multiplying uncontrollable and forming a lump called a tumor. This cell can spread to other parts of the body, making one of the most fierce cancers among women worldwide. The exact causes is still not completely known, but signs point to change in the gene mutation that tell the cells to keep dividing without control. Other factors such as hormones, lifestyle, radiation exposure, and family history can also play a part in triggering the diseases. There are many risk factors to be aware of, and every woman should know the risk factors. Being female, increased age over 40, a family history of breast cancer, obesity, smoking, alcohol, and lack of physical activity, long-term use of hormonal therapy, and late childbirth can also increase the risk. Even so, anyone can affect rich or poor, young or old. But remember, having a risk factor doesn't mean you will develop breast cancer. Awareness and prevention remain your strongest shield. The symptom may appear small at first: a painless lump in the breast or on the arm, a change in shape or size, discharge from the nipple, or redness and dimpling of the skin. Too often, these signs are ignored, but the body whispers before it screams. Pay attention to every whisper. The diagnosis begins with self-awareness. Every woman should perform a self-breast examination once every month, about a week after menstruation. If you feel any lump or change, see a health worker immediately. Clinical breast examination and mammography are essential tools for early detection. And remember, earlier detection saves lives. When breast cancer is left untreated, it can spread to the bones, lung, liver, and brain. This can cause severe pain, weight loss, breathing difficulties, and emotional distress. But the jungle of fear can be conquered through courage, sport, and medical care. Treatment depends on the stage of the disease. It may involve surgery to remove the lump or entire breast,